Hi there. Today I'm going to be reviewing our short lecture PowerPoint on ethics in public health. So let me share my screen with you. And here we go. Let's get started here. So this is a very short lecture, and my goal is to just kind of go over some briefly just some bioethical principles, and then talk about how they apply to public health. And then the rest will be you all in a debate, which is your quiz number 8. So just to briefly start, a definition of ethics is listed here. This is a general definition, basically saying it's a branch of philosophy, and several of you probably taken this philosophy course at Point Loma, and that it includes knowledge about how to live morally and a process of reflecting on what people should do. The knowledge is important. Obviously, that's kind of our foundation, what's considered ethically or morally right or wrong. But then it's necessary to include kind of guidelines on how to reflect on more specific examples because it's not always so clear. I have this little image here on purpose to show like an angel versus a demon, and that's often how we think of ethics, is just we just need to figure out which decision is right or wrong. But as I start walking through some examples, I'll kind of hopefully shed the light on the fact that oftentimes there's just a whole lot of gray, and it's which decision is better than the other one, or which decision is less bad than the other one. So there's 4 bioethical principles that I want you to be very familiar with, and we're just going to walk through these, and then you're going to be applying them to specific examples for your discussion board, which is quiz number 8. The first principle, respect for autonomy. This is a huge one, especially in the United States, and especially right now, I will talk about. And this is basically saying that we are all, as individuals, allowed to do what we want, that we get to have autonomy or control over our own lives. Often when this is used is when people are arguing against mandated school vaccinations, right? So currently the way it stands, and it continues, our laws continue to get a little more stringent on this, especially in California, is that we mandate that children must have a certain set of vaccinations before they're able to enter school, usually in kindergarten. And we're getting stricter and stricter with the exemptions that we are allowing. And this really infringes on people's respect for autonomy, in the sense that they don't get to decide if they want to vaccinate their kids. Well, they do, right? So you can argue both ways. They can decide, and if they decide not to vaccinate, then they just don't get to enjoy our public school options. But oftentimes people will argue that this is infringing on their autonomy rights. Non-maleficence. I always think of Maleficent from Sleeping Beauty, but that's my world in Disney movies. But non-maleficence is essentially saying that oath that physicians take, first do no harm. How can we not promote harm in our patients? So an example of where this bioethical principle can get argued or played out is in the very controversial thing that happens in San Diego. This is exceptionally controversial because the city and the county have different stances on this, but the presence of needle exchange programs. So this is where people who are IV drug users are able to come and drop off their used needles in exchange for clean and new needles at no cost, and there's no punishment associated with this. They can do this anonymously. These programs, as you might imagine, are controversial because people will say, on one side of the argument will say that we are condoning illegal drug use and illegal behaviors, but people who argue with non-maleficence would say, well, actually, we're making sure that they're not doing more harm to themselves by using dirty needles, sharing dirty needles, which promotes infectious disease spread, infections, etc. So the third bioethical principle is beneficence, which is essentially saying that it's kind of going along with non-maleficence, that not only do we want to not do harm, but we want to do good to others, maintaining or enhancing their dignity. So an example where this can come into play is the controversial topic in San Diego of, should we move homeless individuals into specified encampments? This has been done fairly recently in the East Village part of San Diego, close to downtown. And then that action got blamed for why we had the Hep A epidemic, in that we were putting all of these high risk individuals into one area, crowded conditions, non hygienic, and then that was increasing the spread of this infectious disease. So, beneficients would argue that we would not do things of that sort and that we would promote or enhance their dignity by letting them live where they want and not increasing conditions that could hurt them. And then the final principle is distributive justice, kind of going along with themes where we talk about social determinants of health and social justice within public health. It's the idea that there should be a fair distribution of benefits and burdens in society, and that it should be based on people's needs and contributions. So I won't go too much into this one, because I think for those of you who have been assigned to talk about Medicare for All, this will come up for you. But essentially what this is saying is, should we all have fair and equal access to healthcare? And should that be something that is not based on things such as socioeconomic status, income, employment, gender, race, ethnicity, immigration status? Should those things not play into it, but should there be equal, fair distribution of healthcare access for all? You could argue with this definition, well, is everybody contributing the same? And so maybe that should have something to play into, but also you could argue that some people need more access than others, and so should we take that into account? So this is about how do we promote the fairest distribution of health resources, health access, etc. So those were the 4 principles, which I want you to be able to apply at least one of them to your argument for this week's discussion. I also want you to be able to identify one ethical framework. So these are kind of overarching frameworks, like how do we even decide what's ethical or not? And I want you to be able to apply one of these to your argument as well. So there's a few kinds here. The first one is consequentialism, that basically we look at what produces the most good. So kind of like the phrase that the end justifies the means, right? So how can we get to where we want to go, and then what actions promote that? And within that is this idea of utilitarianism. You may have heard of this before. So the greatest good for the greatest number of people. So if we're thinking about the pandemic that is currently happening, how can we save the most lives, right? Because we're looking, the greatest good is health in this scenario. And so how can we promote the greatest good, save the most lives for the most people? Deontology is a completely different way of looking. It is looking at the means and not the end. So an action is either good or bad, and we don't need to worry about the consequences. Now, an extreme example of this that I'll share is one from my mother, who is very much in this, uses this framework for her ethics, deontology. And she basically used to tell me when I was a kid that lying is wrong no matter what. Lying is never a good action. And so if she had been living in World War II times and had been harboring Jews within her home, and Nazis came to her door and said, do you have any Jews hiding here? She would have told them yes, because lying is wrong, lying is a sin. Now, to go along with that, her hope is that God would have rewarded her for not lying and protected her family and the Jews that she was harboring somehow. But anyways, that goes off on another tangent. The idea here is that the action is good or bad, and we're not worried about the consequence. And finally, this last framework goes kind of along with our bioethical principle of distributive justice, but communitarianism is saying that we need to find a balance between our own individual rights and social responsibilities. So, for example, in the case of our current order in California of sheltering in place, which is almost essentially like a mandated quarantine, we are being asked to kind of temper our individual rights. We aren't getting to socialize in the ways that we want to. We aren't getting to go to all the stores and shopping and getting our hair done and all the things that we normally do. So we're tempering those individual rights in order to care for the greater good, our social responsibility, which is preventing the spread of this virus. And so communitarianism is always trying to find that perfect balance where we still have rights, but we're taking care of others. The same goes for mandated vaccinations, for school entry, is that we are tempering individual rights of choosing whether to vaccinate their children in order to promote the common good, which is herd immunity within the school system for our kids. So just a few more points. I wanted you to be clear that the American Nurses Association has a wonderful code of ethics that is linked here. Right here, this is the link. And I just pulled out a quote from it, but basically talking about how we as nurses are to be caring for far more than our individual client needs, but that we should also care about broader health concerns such as world hunger, environmental pollution, lack of access to health care, violation of human rights, and inequitable distribution of nursing and healthcare resources. Lots of things that we talk about in this class. We are to care about those things, not just our individual patient care. And then the American Public Health Association has within it, that's our largest public health association in the United States. They have they have lots of different branches and societies, and their leadership society, I have it linked here, has ethical principles for public health. And here's a couple quotes here that we are to care and work for the empowerment of disenfranchised community members. So helping those who are most disadvantaged, often forgotten about, that we are to also respect the rights of community, or rights of individuals, rights of individuals within our community, right? So we're, again, that balancing, the communitarianism, that we're balancing the needs of those who are often forgotten, overlooked, but also the rights of individuals within our community. I think what's really cool about this document is there is a table in the document that shows the 10 public health essential services, so the things we always refer back to from our wheel, and then has those align with ethical principles. So you can see how we clearly within each of those essential services are applying our ethics. So that's my quick overview. I have a couple articles that I want you to read for this week. There's a podcast it's about 25 minutes, and it's excellent. Interviewing a physician in Italy in their chaos, and talking about how they have had to do what I have listed here, number 2, gravity screening. So basically, he says they don't have a tool currently to screen for who is most likely to benefit from ICU level care, but they have had to, on the fly, decide, okay, this patient who's coming in sick with coronavirus doesn't have much life left or has too many comorbidities. We're not going to treat that patient so that we can save those resources for this younger patient with less health problems who's more likely to survive. And this is something that I'm now reading is being discussed here in the United States, is how are we going to ration care? How are we going to ration ICU beds, ventilators, because we don't have nearly enough if our cases continue to skyrocket in the ways that Italy has, and they are skyrocketing. Our pattern is almost exactly mirroring Italy. We're just behind a few weeks. It's a very scary reality that we're having to face. So that is the number 2 group. So basically, let me just explain to you real quickly, and I'll keep going through these. Basically, what you're doing for this week is your team is assigned one of these topics, and you're either assigned to be for or against the topic. And I know that may be hard if you get assigned the side that you're not feeling with, but that's okay. And if it's a side that is against public health stance, then I encourage you to go out there and find what are the naysayers saying. I can tell you that mandated quarantine, sheltering in place is a hot topic right now because a lot of political conservatives, a lot of Wall Street executives and officials are saying our economy can't take this anymore and we need to stop this sheltering in place because our economy is essentially more important than the lives that could be lost from COVID. And so this is a huge ethical dilemma. Do we choose economy? Do we choose individual lives that are going to be lost to COVID? So that's mandated quarantine or sheltering in place. I just talked about the second one, rationing of coronavirus testing. This is something that we've been doing because we just don't have enough testing kits and supplies in our country. So for those of you in this discussion, I want you to explore why is that the case? And I just think, just a little hint, that has a lot to do with the way that our government has not funded pandemic resources in the past. And we just kind of have a different viewpoint, and we're a lot more um, lax than some other countries as far as our I don't know how to say it, but our heightened kind of jumping on with quarantining people, with testing people, with kind of taking control of people's lives. We really do value respect for autonomy in our culture, and so you'll be able to see that as you read more about our issues with coronavirus testing. Mandated overtime for healthcare workers. This is not always the case that we have mandated overtime, but I would like for those groups to explore what that looks like. And when we're in a pandemic, can we mandate it? Can we mandate that people, healthcare workers, stay home? So it could go either way, mandated overtime, mandated quarantine. What are we doing with healthcare workers? Should we be treating them differently? What are our ethical dilemmas there? And then finally, I have universal health care listed, even though that is my only ethical dilemma that's not necessarily related to COVID. I think it's such an important one that we've touched on with the US healthcare system lectures that I've already done, that I want these two groups to be exploring. What does that look like? And what are the ethics that either promote Medicare for all or are against Medicare for all? And if you can find ways to tie that to our current pandemic, that would be great. If you can pull that into your argument, that would be wonderful. So let me just really quickly go back to our Canvas and show you. So for this week, you have this podcast episode, and you have two different articles about getting tested and about rationing resources and mandated sheltering in place and quarantining. And then for your discussion board, I have all of the details outlined here. Taking a minute. So this isn't published yet. I'll publish it in a minute. But essentially, I have assigned you to a topic and a for or against here. As a team, I want you to post your initial discussion here as a team. So just pick one member to post and to include the different things that are listed there. I do want you to find some outside sources, at least one. Develop a strong argument, and then each individual person must respond at least once within the discussion board, either defending your own stance or creating a rebuttal against your opponent's stance. So have fun with this. I look forward to seeing what you learn and how you may have to take a side that you don't honestly feel, which is also a great learning experience. And that is all I have to share for you today about ethics.